Water is the basis for life. Safe drinking water is essential for sustained life, health, and dignity. The World Health Organization's Universal Declaration of Human Rights recognizes water as an inherent basic need. Yet over 750 million people in the world today do not have access to safe drinking water. To discuss the drinking water dilemma from a global perspective would require this short video become a mini-series. Hence, we will focus only on one country, the United States of America. By the end of this video, you will be convinced that access to safe drinking water is a fundamental human right that should be protected by the federal government. Why does this study matter? Because access to safe drinking water is not some distant concern among developing nations. Maria Herrera, an advocate for accessible clean drinking water in California, tells us that in the Central Valley, all over the state, many communities don't have access to safe, clean, or affordable drinking water. Oftentimes, these are also low-income communities of color, small communities of a couple hundred homes. For decades, they haven't had the luxury of safe drinking water coming out of their taps, and they rely on an old and dilapidated infrastructure. Families have had to pay very high rates for unpotable water and often have had to travel to neighboring communities for clean drinking water. Over 250,000 California residents lack access to clean groundwater and are forced to purchase bottled water. With an annual median household income of $14,000 a year in some of the most severely contaminated areas, some residents are spending 20% of their income to buy potable water. In a 2009 report, the Environmental Protection Agency warned that threats to drinking water are increasing and we can no longer take our drinking water for granted. Because access to safe drinking water is at risk due to a number of factors, we need to act soon to mitigate the problem. Pond and Pedley observed that competing interests of agriculture, industry, and households, together with growing human populations, continue to place increasing demands on water resources and are having serious consequences to their quality. Framing access to safe drinking water in the context of human rights brings a new paradigm with which to approach the problem. The provision of safe drinking water is no longer perceived as a utility or service, but as a legal entitlement with individuals at the center. A rights-based approach integrates the norms, standards, and principles of the international human rights system into the plans, policies, and processes of development. The environmental justice movement was born from this paradigm. Drawing from the civil rights movement, the environmental justice movement has articulated the right to a clean environment. This ethical position asserts that everyone has the right to clean air and water. A distinguishing feature of an environmental justice is that it never considers environmental issues separate from social justice efforts. This movement asserts that these are not privileges, but rather rights for everyone, and that public officials have a special responsibility to protect these rights. So what exactly do we mean when we talk about the rightful access to clean water? The United Nations calls it the protection against arbitrary and illegal disconnections, prohibition of unlawful pollution of water resources, non-discrimination, and access to safe drinking water. It goes further to state that water facilities must be physically accessible and affordable to all. There are many examples of precedent where the law agrees that water is a fundamental human right. The concept of basic water requirements to meet fundamental human needs was first established at the 1977 United Nations Water Conference in Argentina. Decades later, in 2010, 122 countries acknowledged the fundamental right to water during the United Nations General Assembly. Consequently, the UN Human Rights Council adopted a resolution recognizing that the human right to water and sanitation are a part of the right to an adequate standard of living. Under international human rights law, water is implicitly and explicitly protected as a human right, as can be found in the 1979 Convention on the Elimination of All Forms of Discrimination Against Women and the 1989 Convention on the Rights of the Child. Even prisoners of war have the right to drinking water as provided under the Geneva Convention. Unfortunately, there is no international governing body bestowed with the authority to police the world for violations of these rights nor to enforce the resolutions. In the United States, legislation to protect water at the state and federal level also abounds, but grows more impotent with each passing decade. The Safe Drinking Water Act of 1974 established the basic framework for protecting the drinking water of the United States. The 1972 Clean Water Act is the country's main tool for controlling source water pollution, but the Supreme Court figuratively muddied the waters of this act with decisions that upset the historic understanding of what types of water resources it protected. The Clean Water Act was originally designed to protect all bodies of water. However, subsequent Supreme Court decisions exempted creeks and minor tributaries, begging the question, how can the government protect major bodies of water when it has no way of regulating what flows into them? Not all news is bad in the legislation arena, however. In September 2012, Governor Jerry Brown bucked the powerful corporate agribusiness lobby in California and signed the Human Right to Water Bill. This historic legislation established a state policy that ensures every Californian has a human right to safe, clean, affordable, and accessible drinking water. But most legislation at the federal level is outdated and mired in bureaucratic muck to the point it has become dysfunctional. Yet the threats to not only our drinking water supply, but to our water supply in general continue to mount, and we need to act soon to mitigate the problem. Pond and Pedley agree that competing interests together with the growing population and climate change continue to place increasing demands on water resources and are having serious consequences on their quality. So what are some of the threats to our water supply? First, I should note that there are two main sources of fresh water, as explained by Kitchen. Groundwater accounts for 90% of freshwater resources, and rivers are the second major source. This supply depends on annual precipitation in the form of either rain or snow. Climate change is undoubtedly one of the primary threats to the quantity of our water supply, specifically global warming. The Intergovernmental Panel on Climate Change predicts significant warming over the next decade, and Kitchen points out that the American Southwest region is prone to drought. Drought conditions would significantly decrease the amount of water available to the Southwest region of the United States, causing communities to reach their crisis points as well as triggering food shortages, mass migration to other parts of the country, and social unrest. Evidence of imminent drought is already clearly visible. For example, the Colorado River no longer flows to the sea in most years. Water levels in major reservoirs have steadily declined over the past decade, and Lake Mead is a good example. Lake Mead is the massive reservoir created by damming up the Colorado River on the Arizona-Nevada border with the Hoover Dam, and it has dropped to its lowest level ever recorded. According to ORCAD, the lake has been steadily growing more shallow since drought began shrinking the Colorado River in 2000. A threat to the quality of our water supply is pollution. The EPA states on its website that most groundwater used for drinking occurs near the Earth's surface and is easily contaminated, whether it be from carbon emissions that result in acid rain, hundreds of thousands of subsurface injection wells, which store 11% of the nation's fluid waste, or agricultural runoff. Even though the Clean Water Act specifically identifies concentrated animal feeding operations as pollution sources, the EPA has exempted runoff from manure application areas from monitoring requirements simply by labeling it agricultural stormwater instead of cow dung. A contemporary and hotly debated form of groundwater contamination is hydraulic fracturing, also known as fracking. The process of hydraulic fracturing was first developed in the 1940s to stimulate production from oil reservoirs. More recently, this process is used to extract oil and natural gas from underground shale formations that harbor these natural resources. Not only does horizontal fracking use millions of gallons of water per well, it also requires up to 300 tons of mixture of 750 different chemicals. To date, the oil and gas industry has been secretive about exactly what chemicals they use and has lobbied Congress for a variety of protections. It is known, however, that between 2005 and 2009, the oil and gas service companies used fracking products that contain 29 chemicals that are known or possible human carcinogens that are otherwise regulated under the Safe Drinking Water Act for their risk to human health. Economics and current infrastructure are culprits that also threaten the water supply in the U.S. For example, federal contribution to the Clean Water State Revolving Fund, the principal source of federal funding for clean water, is shrinking to the point that the funding gap is $20 billion annually since 1992. So there is a regular increase in the cost to provide drinking water paid by states and municipalities that are then passed on to the residents. Lastly, ineffective compliance monitoring and policy enforcement serves as a threat worthy of elaboration. According to the EPA on its website, the U.S. Environmental Protection Agency has primary responsibility for ensuring the activities required by the Safe Drinking Water Act and many other environmental laws are carried out. So in essence, they're in charge. This is very unfortunate because the EPA is grossly ineffective because, for the most part, the agency's hands are tied. For example, the EPA lacks authority under the Safe Drinking Water Act to regulate hydraulic fracturing. This is never more obvious than with what is popularly known as the Halliburton loophole. Halliburton is a highly influential player in the oil and gas industry. The company website says that the company serves the upstream oil and gas industry throughout the life cycle of the reservoir, from locating hydrocarbons and managing geological data to drilling and formation evaluation, well construction and completion, and optimizing production through the life of the field. The Federal Energy Policy Act of 2005, under the Bush-Cheney administration, contains a provision that has come to be known as the Halliburton loophole. The Act exempts gas drilling and extraction from the requirements in the Underground Injection Control Program of the Safe Drinking Water Act. In a highly publicized reaction to fracking concerns, Congress in 2010 directed the EPA to conduct a $1.9 million study to evaluate fracking's effect on drinking water. In fine bureaucratic fashion, the EPA had to first draft a plan for the study before actually beginning the study itself. Despite the release of a progress report this past December, which did not include any research results or findings, the draft of the final report is not expected until 2014, when it is then submitted for peer review. So it could conceivably be 2 to 3 more years before the final report is presented to Congress. In the meantime, support and enthusiasm for this study has waned. The House Appropriations Committee denied the EPA additional funding of $4.25 million for the study and subsequently directed the EPA to narrow the scope of their study. So who then should be responsible for protecting our right to accessible, clean drinking water? According to the United Nations, the human right to water places certain responsibilities upon governments to take reasonable steps to avoid a contaminated water supply and ensure there is no discrimination for access among its citizens. Ibeku points out that in recent years there has been an increased practice of incorporating the right to a healthy, clean environment into national constitutions. In fact, the constitutional right to a healthy, clean environment can now be found in over 60 national constitutions worldwide, as well as in the constitutions of several states in the United States. I agree with Ibeku. All other agencies and legislation put to task by the United States government to ensure safe drinking water for its citizens have failed, and the only viable solution is to deem safe drinking water a fundamental human right, amend our Constitution to codify that right and to ensure it is protected with the same processes and fervor that protect our rights in other amendments. I stand by this solution, but offer others that may not require a literal act of Congress, such as closing legislative loopholes in existing regulatory mechanisms and let the EPA do its job, increase funding to states and municipalities from the federal level, and implement new technologies to clean, store, and move water, including piping it to drought-stricken areas. Whether we are ready or not, it is time for this nation to address the impending water crisis and embrace the idea that access to safe drinking water is a fundamental human right. Water is the basis for life. Without it, No other right or liberty really matters.